period of the unprecedented novel coronavirus pandemic that is adversely affecting the global socioeconomic space. COVID-19 has brought major disruptions to the global economy and the socioeconomic activities of over 180 countries. One of the major concerns is the stigmatization that COVID-19 patients and survivors have experienced. According to the Ghanaian Times, it is not a plague or an apocalypse. It is not a Chinese or Asian disease, and people with COVID-19 should not be described as spreading the virus. Because of stigmatization, many people who have the disease could fake not to have the virus just because of being scared of being labeled as the one with the coronavirus. Stigmatization for us is the real virus we should all be scared of because it has the potential to disrupt all the efforts that have been made in the past decades to fight against discrimination and stigma. The sad thing today is that many unreasonable people are fueling discrimination against people who have been infected by the virus instead of encouraging those people to be part of efforts to stop the spread of the disease. The absurdity of the coronavirus is that many people become very scared, and the question to ask is, how can people not be stigmatized when affected with the virus? Another question is, how can we understand and fight the disease together if we are unable to understand complex disease like COVID-19 and allow people who are infected to hide it because of stigmatization? In any case, how can anyone think that he or she is protected by discriminating against another because of the person is a COVID-19 patient? In a special paper on stigma around COVID-19, the WHO also said the discrimination stems from three related factors. First, it is a disease that is new and for which there are still many unknowns. Second, everyone is afraid of the unknown. And third, it is easy to associate that fear with others. While the WHO said anxiety is understandable, stigmatizations which stem from it exert a heavy toll on patients. We are of the opinion that not only is stigmatization wrong and unlawful, it is extremely counterproductive. It drives people to hide their illness to avoid discrimination and drives them underground, preventing people from seeking care immediately. We therefore associate ourselves with the government and the authorities in addressing and condemning such misbehavior. As Nigerians, COVID-19 cases exceed 3,000, bringing the total number of confirmed cases in the country to 3,145. The federal government had also expressed last month deep concerns over the stigmatization of people infected with COVID-19 or have undergone the test, saying it is significantly affecting the fight against the virus in Nigeria. Chikwe Iherezu, Director General, Nigeria Center for Disease Control, NCDC, said that the problem has caused some contacts to go into hiding rather than avail themselves for testing, isolation, and treatment for the fear of being stigmatized by their fellow Nigerians. The GG said even as government has made progress in scaling up the testing capacity among other measures, stigmatization will cause all efforts to be counterproductive and have a profound impact on the strategy being deployed to tackle the disease. We need to support and encourage those infected, show love to them, and reintegrate them into the society. We should allow our humanity come true for us, the DG urged. Stigma can undermine social cohesion and prompt possible social isolation of groups, which might contribute to a situation where the virus is more, not less likely to spread. This can result in more severe health problems and difficulties controlling a disease outbreak. Stigma can drive people to hide the illness to avoid discrimination, prevent people from seeking health care immediately, discourage them from adopting healthy behaviors. Evidence clearly shows that stigma and fear around communicable diseases hamper the response. What works is building trust in reliable health services and advice, showing empathy with those affected, understanding the disease itself, and adopting effective practical measures so people can help keep themselves and their loved ones safe. COVID-19 is not a death sentence, and this is a time to show the patient love, kindness, support, and avoid any form of discrimination to them. And that brings us to the end of this edition of The Human Angle. You can send your videos and pictures to news@polshareng.com or programs@polshareng.com, and let's share your experience and views. Also visit our website www.polshareng.com to get more updates from our news stories and videos. You can also follow our social media platforms showing on the screen for further updates on our market reports. Join us by 9 p.m. for our night segments, which will be streamed live on our YouTube, Facebook, and Twitter channels. Till we come your way again, thank you for watching, and please keep staying safe.